Well, wait, tuko kwa kamera gani? Ile. Oh, okay, sorry. I was reading the newspaper, guys. Kumbe inakuanga interesting. It's all good. It's a very interesting read. By the way, you can pick it up, although I don't seem like I'm canvassing for them. But it is what it is. It's a beautiful Wednesday morning. I hope you're doing well. My name is Will Saburu. Every Wednesday, we like to talk matters health here. Of course, after such a heated political discourse, we want to shift focus now to matters health. And most importantly, today we want to talk about HIV, nutrition HIV. I said that right,
yes.
Right? All right. And to help us with this discussion is a lovely lady here. I'll allow her to introduce herself.
Hi, Willis.
How are you doing? Happy New Year.
Happy New Year. Oh,
Yes.
by the way.
Yeah, and the last time you were here was last year. Yes.
Happy New Year. So very grateful for being here. My name is Joyce Awor. I'm a clinical nutritionist, clinical dietitian. I'm based in Nairobi and its environs.
Nairobi and its environs. All right. So, of course, today, one of the things that people struggle with, of course, there are a whole other set of statistics on the prevalence of HIV, and especially, I think, between the age of 15 to 19 now, there are different changes in that regard. But even beyond that, first of all, when you talk about nutrition in HIV, what are we looking at?
We need to first realize what HIV does to a human body.
Right.
Because once you get the HIV virus, which is the human immunodeficiency virus, it attacks your immune cells. Those are the CD4 cells that are based for immunity in the body. And once it attacks that, then you realize you have a lot of your immunity is not as good as it's supposed to be. Then therefore you get things like opportunistic infections, which are the pneumonia, the TBs, and any other infections that take advantage of the not so good immune system.
Right.
So when that happens, these opportunistic infections come with some symptoms, some signs that will make you not digest food as it's supposed to. You won't absorb food. Food intake will also decrease, and that will greatly impact the nutrition status of the individual.
Right.
Yeah.
So now, if now that we have realized that, just like I said earlier, on the statistics are that people are getting HIV and AIDS earlier. So would you say now there is a difference in terms of nutrition from those who unfortunately get it maybe at 15 to 19, those who get it maybe in their 30s, and then of course those who probably realize they've gotten it or get it at an advanced age? And I'm careful to say what advanced age is because people are very sensitive on that, yes.
Yeah, so nutrition is different in terms of where you are, what's your age, what's your physical activity, what's your intake, what's your financial status, your functionality. So once you get to see a dietitian, we do what we call a body composition analysis. So depending with your age and all that, your weight, your height, your BMI, your body composition, you'll tell us your fat mass, your water mass, your bone percentage, all that. So we get to talk to you individually. And definitely nutrition will be different in terms of kids because kids still need that extra energy as they're growing.
Right.
Teenagers will still have a different set of nutrition guidelines for the elderly and also the young adults. All of them will have different nutrition considerations.
Right.
But once you get to our clinical dietitians, we do what we call the nutrition care process, where we do the assessment. We do the biochemicals as well. We do your clinical. We check what are you presenting with. We check your diet history. We check your economical and social cycle setup, things like that, and also your functionality. So all that will now tell us what to do in terms of diagnosis and intervention and monitor and evaluation.
So if, let's say somebody who is watching, a parent who is watching and they have a 16-year-old, or it was even for those who are born with it, passed through what, I guess let's start with this one because now those are two different people. For the 16-year-old, 17-year-old, this is probably what would have been some of the most active years. But now with the virus, what does that do to them, and then what does that change in terms of their nutrition? Okay,
before I get to that, I would like to just state that once you get exposed, it's more advised to go and get checked. Because once you get checked and we know you have the virus, before it gets to being an AIDS, before it gets to being the acquired immunodeficiency syndrome, there's so much you can do to boost your immunity then before it gets to AIDS.
Right.
So once you boost your immunity, you won't get to things like opportunistic infections.
Right.
So your immunity system will be better as compared to somebody who got the infection and stayed longer until it started manifesting symptoms and then they went to check.
Right.
So that's different.
Okay.
So for this baby, this young one who was born with, we'll have to take them through and see what are they manifesting with now. What is their stage? Because the HIV has 3 stages. There's the acute, there's the asymptomatic, and symptomatic stage. So all the 3 stages will have different types of nutrition guidelines. So depending on what you present with, at what stage you're diagnosed at, then now we talk to you independent to that. Because the first stage, you're losing like some 10% of weight loss, you haven't had any symptoms, your viral load is very high at that point. Then the second stage, you're losing 20 to 30% of weight loss, so the nutrition again will change totally. Then the third stage, where you maybe be, now you're full-blown HIV AIDS patient, then now the nutrition guidelines also changes altogether, because now you have symptoms, you have the all the maybe some opportunistic infections that come at play. So the guidelines changes a lot.
They change a lot, all right. And so then, of course, what would then a healthy diet look like, just on a general scope, for somebody who has been diagnosed? And now that you've presented the different cases, I don't know if we'll compartmentalize them. Is it different for different people at different stages?
Yes, okay. It is. But again, depends on what you're presenting with.
So what you're presenting would be like...
if you have nausea, are you vomiting? Are you having diarrhea? Do you have tuberculosis? Do you have pneumonia? Okay. Do you have the cancer Kaposi sarcoma that is one of the opportunistic infections? So all that will be different. Do you have reflux? Do you have heartburn? So you can find a patient who is in stage 2 but doesn't have the Kaposi sarcoma, doesn't have the TB yet, doesn't have all that. So depending on what you come with, we see you then. But in regards to the nutrition guidelines, if you again, we do the assessment. So once we see maybe you have weight loss, so we check and see how can we regain that weight. How can we, once you regain the weight, how can you maintain that weight and not have any other weight loss? If you're having things like nausea, vomiting, can we give you appetizers? Can we give you, what is your intake? Can you have a lot of fruits? Can you have a lot of vegetables? Things like that. Yes.
So if we just to follow up on that, so for example, for somebody who has nausea and probably they're vomiting, what kind of foods are they supposed to take?
Okay, so things like vomiting, you want to have soluble fiber, not the insoluble. So soluble fiber, I'm talking about fruits and vegetables. Insoluble fiber is what we get from our whole foods, our cereals, things like that. So you'll have more of fruits, more of vegetables, the frequency will increase. If you can have a higher intake, then the intake will also increase then as the frequency increases. So if you're having nausea, we will most likely want you to have your favorite meal. And then also you try and not prepare foods that have strong scents, because you realize that scent is what will most likely put you off. So maybe people can come in and try and prepare the food for you or with you, things like that. Try and eat small, frequent, lots of fluids. Try and walk around. Don't just lay seated or sleep most of the time. So all that walking and will help you out.
Right. And then so for the other group that you mentioned, so those who want to know, there is normally something, of course, there are misconceptions about weight gain for those who, especially now if you know that you have the virus, and just already people who rather struggle with gaining weight, they already have their own misconceptions. So they say, I'll just go and eat a lot of junk food and I'll gain weight. So now you have an immune system that is sort of compromised,
yeah.
And you want to gain weight as well. So what are some of the things you are eating?
So you'll most likely go and see a clinical dietitian. Will work with you. They'll give you a plan. They'll calculate what you need in a day, what you need per meal, per snack, such that by the end of that day, you have in your total calories. Sorry. So after you worked on your calories, then they'll also work on which type of foods, how you preparing your food. Are you overcooking your greens? Because once you overcook your greens, you're losing your vitamins. Are you juicing your fruits instead of blending? Because once you juice, all the fiber remains in the juice and you only have the fluid. Something else is your food pairings. How you pairing your food? Are you having tea with your food? So therefore, you're blocking some of the iron from being absorbed. Are you cooking with milk in your greens? Again, that calcium blocks iron. So
a lot of people do that. The
it's
cream.
not advisable.
What about the cream?
It's not advisable. No.
Okay.
Once in a while it's good because you want to change the taste, you want to do that. But frequency, don't do it every other time.
Right.
Yeah. So we'll check your food preparation, food frequency, food pairing. Your food. Calories per food, per meal, what are you having in a whole day, things like that.
So the idea is just to get more in.
Yes.
Than
more frequently,
yes.
But not like a whole.
And in a
whole plate, yes, right. And definitely healthy.
Okay. So end up finye
fries and pizza and hot.
Now, we are on gaining weight. All right. I want to ask you if you also have some questions as well. And this is the question you're asking. Question. Then how you can get in touch with us. What questions do you have on nutrition? On nutrition in HIV and AIDS. What questions do you have on nutrition in HIV and AIDS? You can simply send us an SMS on 22422 and use the hashtag Daybreak. We will be able to sample them as we proceed. Now, as I normally say, it is better for you to use that hashtag. I mean, it's better for you to use the SMS. If you want to remain anonymous, then we will be able to do that for you. You don't have to tell us where you're watching, because we do understand it's a sensitive topic. So if you do not want to tell us your name, then go ahead and use your SMS from 2242. But, sorry, if you feel confident enough, then go ahead and use that hashtag Daybreak. Or if you have a pseudo account. But we can, because I just want to let you know that if you do use a hashtag, we'll have your Twitter handle on display. But please ask those questions that you have, and let's help each other. Now, when it comes to nutrition, there's also some medications. Most of the medications we have, don't take milk, don't do this. Can the medications that people are taking have some effects in terms of, or guide you on what you're going to eat?
Yes. Yeah. Medications, something we call food and drug nutrient interaction.
Right.
So once you see a nutritionist or a clinical dietitian, then they're able to go through with you, because specific people have different types of medications.
Right.
So once you see a dietitian, they're able to see what medications you're having and what are the interactions. Because there are medications that you're not supposed to have with, if you're taking ginger, a lot of garlic. There are medications you're not supposed to drink with milk. There are medications you take after food. So all that interactions need to be had, the discussion needs to be had with a nutritionist so that they can know what medications you're having and what the interactions are. Mm-hmm. Yeah. And
also in terms of there is, again, because the immune system is compromised, how is there an issue also about handling of the food? In terms of, you can easily get some foodborne diseases. That's the word, right?
Yes.
You can get some foodborne diseases. How do you handle food so that to make sure that, again, your immune system is very compromised? How do you handle food?
Now, people who are HIV and AIDS positive, they need to be very keen with hygiene, extremely keen, more keen than you've ever been. Because if you have things like diarrhea, they can really take you down. If you have something like vomiting, it can really take you down. So you need to be able to wash your hands frequently. If you don't have running water, try and get some clean water. You need to be able to wash your foods as frequently before you prepare them. You need to be able to boil your food. For example, your proteins need to be boiled till a specific degree so that they're not undercooked. Things like beans, your legumes, you need to soak them so that once you soak them, you can now absorb the most amount of iron, the nutrients in the beans. You can absorb them better. So you really need to check on your hygiene in terms of handling food, in terms of food safety, where you're buying your food from, do you know the vendor?
Right.
Is it a place that you're familiar with, or is it grown by the roadside, things like that. So you need to be very, very keen.
And so you mentioned something there again. Is there a difference or a nutritional value in terms of, so there's different ways of cooking food: steaming, boiling, frying, pan searing, I think they call it. Is there a difference, like, and what would be that difference in terms of looking at it in nutrition? What benefits do they have?
So for example, vegetables, people who want to boil their vegetables, you realize all these water-soluble vitamins are denatured, or rather they are killed once they are exposed to a lot of heat. So once you boil your vegetables and you want to pour out that water, that whatever is in the water are the nutrients. So you're basically pouring out the nutrients. So if you want to, the people who want to parboil their vegetables, so what you do is that liquid, use it as a broth somewhere so that you can get the vitamins. Things like vegetables, cauliflower, the broccoli, they should be at least pan-fried and not exposed to a long term of cooking. The kienyeji, we normally want to cook them forever, but now the vitamin content goes down. We get a lot of roughage, but the iron per se is not in a good amount as compared to somebody who's taking spinach, skuma, and the broccoli and cauliflower. Things like meat, if you deep fry in terms of calories, once you deep fry in fat, it gets fat, and fat also has its own calories apart from the protein calories. So if you are gaining weight, deep frying is not a good way of doing it. If you can grill, if you can bake, if you can, what is this people put?
Grill?
No, this new machine that has come. Okay, the word is...
There's a new machine.
No. There's a device where you...
Yes, I know what you say. Yes. I forget the name as well. Yes, but
yes,
I see it.
You see it?
I see it, yes.
So that is also a better way of cooking food than deep frying.
Air fryer.
Yes, air fryer. Yes. Thank you. So that is also better because you realize you're not using as much fat as you would have if you are deep frying.
Right.
Yes, so you have calories from fat, calories from the protein. So the type of cooking will also increase your calories depending on what your goal is. Are you losing weight? Are you gaining weight? So it depends.
What about the things that we talk about just when you're talking about good nutrition generally, like red meat, white meat? Yes.
This debate, Willis.
Yeah, watu wanapenda nyama choma kwa inchi.
I know. So we normally say white meat is better.
Okay.
Yes, because it's the lean type of protein.
Okay.
Yeah, especially if you remove the skin from the chicken and your fish is not deep fried. Have it fresh.
Right.
So those two are better.
Fresh means boil it?
No.
Or stew it?
Not really. When you go to the mama, what were fish saw it nani?
Your age, mama.
The guys who sell fish.
Right.
The guys who sell fish. So you get fish fresh, not the one they have deep fried.
Okay.
Yes. So once you get the fresh one, definitely the scales have been removed and all that preparation has been done. So the fresh fish, then you go and fry it. Pan fry it, you stew it. That's a healthier way than the deep fried one. Exactly.
Okay.
Then your chicken, you can grill, you can bake, you can stew it. But if you boil it, it won't be as palatable as the other three ways. Red meat has a lot of hidden fat. That is why we like to reduce it, but don't have a lot of it. Nyama choma, our issue is normally the meat is prepared for a short amount of time, exposed to a lot of heat in a short amount of time. And that is what brings in the carcinogens. And also the charring of the nyama choma, kuchoma, the blackness, is also what predisposes you to the carcinogens. Yes.
What about, because again, for those who want to continue, with their normal, so to speak, lifestyle, though, like we said, their immune system has been compromised, there are those who maybe before were smoking or drinking. What happens in this case in terms of, consuming that now?
So once you're positive, you're definitely on medications.
Right.
These medications do not want alcohol. These medications don't want smoking. So it goes without saying that those two have to be stopped. No smoking, no drinking of any type. No wine. No
wine, even for the stomach's sake?
Nah, zero.
Wow.
Because for the medications to work, they can't work with alcohol. Yeah, so you need maximum absorption of the medications, and alcohol and smoking tend to hinder the mechanisms of the medications.
So no smoking and
no alcohol.
Already just for watu tu wa kawaida pia wanasamanga hiyo ni shida.
We limit watu wa kawaida.
So anyway, it's okay. We hope that those you can learn from those and make those changes. Some of them are normally very hard, and also over and above that, of course, there's people always pair nutrition with exercise as well. And so it's like they normally say, most of it is in the kitchen, not really out there. So what are people who have HIV and AIDS free to exercise, or they just solely depend on the nutrition and that's it?
So exercise is a rule of thumb for everyone, whether HIV positive or not.
Okay.
because once you do exercise, your metabolic age goes lower, meaning you are able to metabolize nutrients more efficiently, other than somebody who does not exercise. Once you exercise, you have the appetite increases. Once you exercise, your body image gets better, because now you don't look emaciated, you don't look obese, you look like somebody who's healthy. So exercise is very important for, it cuts across whether positive or not, because it has very good, what?
First of all,
effects.
Good effects, yeah. Even just the feeling.
Exactly.
They call endorphins, I think. And also, one of the other things is, so there could be somebody who is HIV positive and pregnant. What are some of their nutritional needs?
Okay, so before we get to the nutrition needs, it's important for, once you are pregnant, to go for your antenatal care, where they check your HIV status. So if you're positive, then you're put on medications. These medications need to be adhered to in terms of time, in terms of frequency, in terms of especially how it has been prescribed by the doctor. So once you adhere to that medication, then now your viral load decreases and your CD4 cells increases. So that is what, CD4 cells is what we mean by immunity. Then now you can, for the next 9 months, you continue medications as prescribed. Then at least your antibodies and antigens will be able to fight the HIV antigens, actually. The HIV antibodies will be able to fight the HIV antigens in the body. So once you deliver, the baby is also put on HIV prophylaxis. These are medications that help the baby not to get HIV virus. And they also need to be checked, their status, especially at the 6-week immunization point. The baby is checked for HIV. And if the mother's viral load was low enough, then the baby would not come as positive. But mothers who are not adhering to the medications, mothers who gave up in terms of HIV and all that, then now the baby will unfortunately be born positive. Yeah. So in terms of nutrition, then the nutrition guidelines and nutrition requirements are higher because of the HIV virus itself. Again, also because of their pregnancy status. So they'll need more iron. Actually, they'll be put on the IFAS, that is on the supplement, iron folic acid supplements, which they have to take for a period of time. So that is just to boost their iron stores, to boost their folic acid stores, so that they deliver a healthy baby. So their nutrition needs will go up. They need to be more adherence to the medication, and then they'll deliver a HIV negative baby. Yeah.
All right. So I'm told we have some feedback here. Let's take a look at some of them, what you are saying on your SMS platform here. And probably we can get them on one of these other screens as well, key teeters. All right, so at what period in HIV and AIDS can be detected in blood tests? That's somebody asking. What period can they be detected?
I'm not quite conversant to the blood test. That will take a physician to do that. But it's good to take it as soon as you feel you have been exposed. The medications you're given, the PEP medications, either the post-exposure medications or the pre-exposure. So depending on, are you exposed or do you feel like you will be exposed, then you given that medication. In terms of tests, they'll do I think it's a rapid HIV antigen. I'm not very conversant with the test. But there are tests that are done before, after you have been exposed, and then you come back, I think 3 months or 6 months, and the test is done again. Because when it's done immediately after, then the body has not presented any HIV antibodies for it to be tested. So you're tested now, you can be found to be negative, and then maybe 3-4 months later, now when the body has antibodies for HIV, then now you're positive. So these antibodies is what is tested in the blood. So once you have antibodies, it means you have the HIV antigen, which is the virus, because you can't have an antibody to fight an antigen that is not there. So once you have the virus, then the body will get the antibodies to fight that virus. So if you find that the HIV antibodies are present, then it means you are positive, because the antibodies are fighting the antigens. Yes. Okay. So there are various blood tests depending on where you are and what you are exposed to.
But if you feel you've been exposed, go get tested and then repeat it probably after 3 months?
Yes.
All right.
Yeah.
All right, let's take a look at another question here. Can you know which food that enables people with HIV and AIDS in Kenya to live long? Is there foods that help you live longer?
Yes, there are. At least there's medication now so that you can live longer, depending on your adherence. So if you adhere to your medications, then your CD4 count will get higher. This is the immune cells that help you fight immunity. And now your viral load gets lower. It can even get to a point that it is undetected with a test, or it is actually suppressed totally. So then you're not able to transmit the virus. But in terms of living longer, I'd say just a healthy diet, a high immune diet. So basically visit a clinical nutritionist. They'll talk to you. They'll go with you step by step and see what are you having now, what is the stage you are at now. Then they'll advise you pole, and yeah, eventually you'll live longer.
Right. All right, somebody's asking here, but this is, I guess, people want to know, but we've, I think, answered it partly in the first question. How long does it take for one to know that he or she is positive? What are the signs, even if you've not had a test? All right, so there is, I guess, they say the window is what, 3 months?
At least 3 months, because you can be exposed today, and if you check 2 days after, you might be negative, because as I said, the HIV, your body has not yet gotten the antibodies to fight the antigen. So that's why we say come again and check again later. So then we check, do you have any antibodies, HIV antibodies? If you do, then now you're positive. If you don't, then you're negative. Right. But you can be taken through all those steps, all those tests, once you get to a lab pathologist, once you see your physician. In terms of what are the symptoms to see you have, it is said that you'll have flu-like symptoms when you start, but I'm not quite sure in terms of symptoms, but your physician should be able to guide you through. Yeah.
All right, so Robert Mbusia says, does the last stage of HIV and AIDS respond positively to good nutrition?
Oh, that's an interesting question.
Right.
Because the last stage is where you have opportunistic infections, where you have your nausea, you have your vomiting, you have TB, you have pneumonia. You can either have any or all.
Right.
And when you have that, now your nutrient intake has been compromised in terms of absorption, in terms of even the nutrient quality that goes in your blood. So it's quite interesting at that point, but all is not lost. If you see a nutritionist, we can now go with you step by step and tell you, now you're at this stage, eat these foods and not these other foods. Cook this way and not the other way that maybe a stage 1 person would cook. Eat this more than whatever else you would eat as compared to somebody who's in stage 1. So it just depends what you're presenting with. And yeah, as we say, nutrition is individualized. So I can't say stage 4, all of you guys do 1, 2, 3, and all of you do the other. So I need to see one person at a time and guide individually.
All right. Somebody asking is, are there any specific foods or dietary supplements that people living with HIV and AIDS should avoid? And if so, why?
Foods to avoid, I would say any unhealthy food. Those are the saturated foods, because you'll now find you get a lot of unhealthy fats in your system, and you don't need this. You need the healthy type of fats. So those are the omega-3s and such like. You can be put on probiotics just to help your gut, because once you are HIV infected, then your gut, having been the place that has the most immune cells, is also affected. So it can put you on probiotics and prebiotics just to help the food absorption and things like that. You can be put on type of diets, maybe a high protein diet, maybe a high calorie diet, just to boost you up. Yeah, things like that. I don't know if there are specific foods that you need to avoid, but let's try and eat healthy. Yeah.
All right. James from Magombo says, does alcohol intake hamper HIV patients? Because I am a consumer. Says he takes alcohol.
If you're a consumer and you're taking your medications, it will definitely hamper your medications. And once your medications can't work properly, then your viral load will increase and your HIV status, or rather your AIDS will be very full-blown, where you get all the other opportunistic infections. So I'd rather you don't take alcohol, just focus on your health and take other healthier snacks. Once you see a nutritionist, there are various healthier snacks we can prescribe for you.
Right. All right, someone says, how about if one has HIV and another one does not? How can that work? In terms of, I guess, of course, there is the medical side, but also I think one more thing that needs to be discussed even as we answer this question is I guess also in a home setup, one thing that people need to know is if one is and one not, or you live in a family setup, your nutritional needs are going to be very different from the rest of the people, and therefore do you need to kind of inform them or have special arrangements, or what happens?
That will depend, because it will depend what are the other nutrition status for the other family members. So once you're HIV positive, do you have an obese person in your family? Do you have an overweight person? Because if you're HIV positive, now we'll put you on a high protein, high calorie diet, which an obese and overweight person will not need that type of diet. So once you go and see a nutritionist, we'll like to know what is your social setup, what are the people in your house like, what is the nutrition status. If all of you are, for example, malnourished, then this type of diet will fit everyone. But if there are some who are overweight, some are obese, then now this will be your type of diet, but all the others, they'll have to have a different type of diet. So in terms of one person is positive, one is not, the person who's positive needs to adhere to medication so that they can reduce their viral load completely, such that they are not able to transmit this HIV to their partner as well. Yes, because HIV is transmitted by fluids, blood transfusion, there's pregnancy and such like. So once you have a partner, sexual transmission of HIV can happen. But if your viral load is very suppressed and very low, then you find you are not able to transmit to your partner. So adherence to medication, there needs to be support from your social setup, your family members. They should not stigmatize you, such that the cup you're using is just your cup, is not for anyone else. They cook for you separately. That should not happen, because HIV cannot be transmitted with food and cups and things like that. So once hygiene is top notch, then you can all eat as a family. And now the diet is what will say, are you overweight people? Do you have obese people? Are you malnourished? That is what will guide us when you're doing a diet plan.
All right, somebody's asking what could be the problem where one has been engaged to a HIV person but tests negative when tested. I don't know if that is a problem per se, but anyway, yeah.
You can find that probably this HIV person you were engaged with had a very low viral load, either undetected or even suppressed. Therefore, they're not able to transmit the virus to this person who's negative. Yeah, that is
so. Yeah, but you should be.
Take precaution.
Yes, and also you should be. I mean, if you're negative, I don't think it's a problem. If you're engaged and you're negative, you take the win and move on.
But it also depends, when were you tested? Are you tested like immediately after? Then you need to go again and get tested later on, so that we see, do you have any antibodies for the antigen?
Right. Okay, so again, if you've been tested and negative, try again in 3 months and see
are you still negative?
You don't do that in premarital. Anakupatianga tu ile. Yeah, anyway, so hello, my husband is HIV positive, I'm HIV negative. We have been together for 7 years now and we don't use protection. My question is, am I safe because I'm 6 months pregnant and still negative? Yeah. They've been together for 7 years and they don't use protection. And she's asking if she's safe because now she's 6 months pregnant and she's still negative.
Yeah, she could be safe. Depends again on the viral load of the husband.
Right.
If the viral load is suppressed and not detectable, then she's definitely safe, because the husband is not able to transmit the virus. Yeah. And
also it's been 7 years.
Yeah. So the husband needs to continue with the adherence, because some people, once you get to the undetectable phase, then now you do away with your drugs. But remember, the viral load can still crop up, and you can still infect people. So you need to continue with the medication.
Right, continue the medication. And also, for the person, of course, we said on the SMS platform, you remain anonymous, but we wish you all the best with your pregnancy as well. This is JB. How can someone control the virus within 72 hours before the antibodies get contaminated by the virus?
Okay. So at this point, this is where we say you go for the post-exposure prophylaxis, the PEP medication, which is more effective in 24 hours, but it still works up to 72 hours. So 3 days within which you feel you were exposed, go and get the PEP medication. But it's more efficient if you go less than 72 hours, maybe a day or 2 days, go and get the PEP medication. This medication is taken for 28 days, and of which after you go and get tested.
Again?
Yes. Remember, this will be only a month after your exposure. But again, 3-4 months later, you need to go back and get tested just to see, did you have any antibodies? Did the medications work or things like that? Yeah.
All right, so we're going to wait on the questions first, and I want to ask you some specific questions as well, because I want to go back to what you know, you talked about opportunistic infections, and then you get whether it is TB, whether it is an STI, hepatitis C, B, COVID.
Yes.
What would be some of the nutritional considerations when somebody has an opportunistic infection?
This will depend with a specific infection.
Let's say now COVID.
COVID will come with definitely a more compromised immune system altogether. Then you might be, your taste buds will disappear, your food intake, because once you can't taste food, then the food intake decreases. So we might give you, what do we call these things? To boost your appetite boosters, to just increase your appetite. It will give you...
this is in supplement form or is or a food?
It most likely will be a supplement,
okay.
Yeah, as much as we'll do a diet in terms of food. We'll also do pro and prebiotics such that your gut can absorb as much nutrients as possible, just to restore the gut. Then we'll most definitely do also a diet plan in terms of what you're having. Are you nauseated? Are you taste buds? Will give you a zinc type of supplement just to boost your zinc, your taste buds. And your immunity, vitamin C foods, fruits, things like that. So we'll slot them into a diet plan such that you're having more of vitamin C, more of the zinc foods, more of the appetite-giving foods. Yeah.
Is it, if you talk about now the specific, we've talked about children, adolescents, is it different in terms of nutrition for women and men, or is there a big difference?
There could be a slight difference because, you know, men, their metabolic would be, is it lower or higher? There's a slight difference. And then men engage in more engaging activities. So again, it depends on the assessment that we have carried out. What is happening? Do you want to gain weight? Do you want to lose weight? What are you presenting with? So we'll deal with you individually. But there's a slight difference, just depending on what you're presenting with.
What about now for the older people? For them, what are they supposed to look at? And I don't know what older would be. I don't know if it's 55, 65. Yeah, what would they look into?
So older people will depend. Are you retired or are you still working?
Okay.
So that will definitely be one of the things we'll look at. And because if you are retired, then now you will need a low carbohydrate because you won't need as much energy as somebody who is still working. So, but we'll all give you the protein requirements as per the elderly because you still need that muscle building, you still need that muscle mass. You will still engage in physical activity because, as we said, there are good effects of physical activity. So elderly people also have their own guidelines as opposed to the other people, and yeah.
Okay, so everybody has their own guidelines. Let's go back to the questions here. I think you've mentioned PEP a lot. Somebody's asking how many times should one take PEP in a year? What are the side effects of taking it more times?
Now that I'm not quite conversant in terms of medications, but I'm sure there's a limit. I'm sure there's a limit of taking PEP, but I wouldn't know. I haven't done that type of research yet.
All right. This question, I think we've answered it, but let's go ahead and take a look. Someone who's HIV and AIDS positive taking ARVs, or I think they call it ART, antiretroviral therapy, transmits the virus sexually, and you've talked about viral load. Is it true that there are some people who can be HIV positive, but the test showed negative, and they say that these people can transmit the virus, but if they get tested, they get negative results? Carriers, or you would like to speak?
So once you are positive and you test, okay, what was the question? You test positive?
Yeah, you test, so positive? You test.
You are positive and test
You're
negative.
testing, the test shows you're negative, but somehow they're saying that these people can still transmit the virus. They're asking if this is true.
It could be, because remember there's a window period where you don't have your antibodies yet to fight your antigen.
Right.
So this period you're still positive, yes? But you haven't tested positive because what you test is the antibodies. So if you haven't yet gotten the antibodies for the antigen, at least when you were exposed, then now you will test negative, but you can transmit positive, okay, you can transmit the HIV because you still have the antigen. But once you come again and get tested, then now you will be positive because now you'll have the antibodies, the HIV antibodies that will be tested positive. Yes.
Right. And then,
I don't know if I got that question.
Yeah, because I think
it was a bit.
It was Dan Wells. All right, go ahead and we'll get some questions here as well. But also, as we talk about that, one of the things we talked about in the beginning is that HIV basically it affects absorption. So, is there something that can be done nutritionally to help? In terms of whether it's the preparation of the food or the type of food you're taking that will help you, get those nutrients in.
Yeah, so in terms of, for example, protein, now you'll have to take the high biological value protein. This is what is well absorbed in the body. So these are your white meat, your red meat, as opposed to having your legumes. So you'll take more of your animal proteins, and just to break the monotony, you'll have your legumes. So also in terms of absorption, you can be put on some medications or some non-pharmacological things, maybe things like supplements, just to boost your protein, boost your calories, boost your intake generally.
Right.
So yes, you can be put on some specific diet just for malabsorption patients.
And somebody's asking here in terms of also the nutrition and medication. His name is Frank. He says, what can I do nutrition-wise to protect myself from the virus if I am to marry a positive lady and I also want to get a child with her? Yeah.
Okay. So one, make sure the lady is adherent to medication so that they can reduce their viral load, increase their immunity, the CD4 cells. Then now you can engage in a healthy diet in terms of immunity boosting diet.
Right.
You can also engage in the good quality food. Preparation also, you have to talk to a nutritionist to get how to prepare food in terms of matching, in terms of timing of preparation, food hygiene, food safety. All that is a whole discussion. Yeah.
Somebody's asking us about blood groups. Good morning. My question is this: is there any blood group that is stronger in terms of nutrition and getting the HIV infection? This is John Otikiri from Malaba.
Wow, that is an interesting question. I don't know how to answer that because I'm not a physician,
yes.
So I wouldn't know if there's a stronger blood group. I don't want to lie.
Yeah, well,
I don't know.
John Otikiri. Yeah, we shall.
We'll ask a physician.
All right. Can BMI be a positive indicator for HIV vulnerability?
Wow. So once you are, what do we call it? Overweight and obesity, that is a higher BMI, higher than 25. Then now your immunity would be an issue. And then also remember you are exposed to things like hypertension, you're exposed to obesity, you're exposed to some type of cancers. And I don't know if it's related to HIV, because HIV is just, have you acquired the virus?
Right.
Is it through blood transfusion? Is it through sexual transmission? Is it through pregnancy? So that is how you transmit the virus. But in terms of BMI, unless you are exposed to a HIV infected person.
Okay.
Yeah.
Then there's somebody here who's... Okay, they're very interesting questions here. Somebody is asking, anyway, what are the best diets for HIV late stage, that is stage 4?
That will need the person to visit a clinical dietitian. We'll do the assessment, we'll do the diagnosis, the nutrition diagnosis, then now we'll intervene depending on what assessments we've seen. There's definitely a diet for high protein, high calorie, but it will depend because I might put you in a high calorie and yet you come in and you are overweight and you are obese. So that will not work for you.
Okay.
So you'll have to come in, then I'll calculate how many calories do you need in a day. How do we break it down in terms of meals per 3 hours or something like that? So you need to visit a clinical dietitian and get that worked up for you.
All right. Okay, so there are many questions here about PrEP as well. And somebody's asking, so if I have TB, what do I need nutritionally?
So you'll need, because with TB, you'll be coughing a lot. Right. So you'll need less milk.
Okay.
Because milk aggravates the mucus and hence you'll cough more frequently. So you'll need immune boosters in terms of diet, what will increase your immunity in terms of the citrus foods. So that is a lot of oranges, limes, ginger, turmeric helps with the coughing. What we call dawa, that is the ginger, lemon, and honey. All that will soothe your throat. You'll need a high protein diet so that you can boost your immunity as well. You might need a supplement depending on the anthropometric measures that you present with. So it depends.
I was going to ask what anthropometric means.
Anthropometric means your height, your weight, what is your BMI, what is the ideal body weight, what is your water percentage, your body mass, your fat percentage. Basically, what is your body composed of? What is your body composition?
Right. And then someone says, does ARV affect nutrition?
Yes, medication generally does, because you realize that is a medication you take through your gut, and it might go and corrode your gut as it is taken in. Not all medications,
So
but some.
Reflux
It can give you reflux, it can give you malabsorptions, things like that. So it can also give you nausea and vomiting, depending on the medication. It can make you drowsy, because once you're drowsy, you won't eat as frequent as possible. We talked about it can give you reflux, nausea, vomiting. So depending on your medication, so you come in, I see your profile, medication profile, so I can somewhat know the side effects of that drug, and we can manage it. Yeah.
Someone says, good morning, citizen. This is my question. I was given a nutritional plan, but somehow I keep skipping meals. What is the solution?
Your solution would be go back to your nutritionist,
right,
who gave you the plan. Tell them you're skipping meals, so they can work with you with what is available for you. Are you skipping meals because of work? Are you skipping meals because
you don't like
the food?
The food, yeah.
Yeah, so go back with your plan to that nutritionist, and they can tweak it up for you in terms of your lifestyle.
So when you're making that plan, what are some of the important things to disclose so that we're not in this position? So what are you telling your nutritionist in terms of, so if they say, for example, you need to take broccoli, and you're like, I don't like it, or what do you disclose when you're making this plan?
Ideally, first you'll tell me what is your normal diet like, what are you having normally, so that I can get a feel of what is available where you are. You tell me what your lifestyle is, like do you wake up at midday? So I'll know you won't have your breakfast and lunch. You tell me also, are you an early riser? When you wake up, do you just go to work directly and you don't have breakfast, you work, things like that. Do you also go to the gym? So I know this time is for gym, this time you're maybe recovering. So I have to work with what is your lifestyle, basically. So then we have things like not skipping meals, things like you don't like something, because I'll ask you, do you have any allergies? Do you have any dislikes of food? So that I don't put food like a broccoli and you don't like broccoli. I don't say cook with onions and maybe you don't like onions. I don't say look for peach and where you're staying, there's no even strawberry, you see. So we need to know what is your lifestyle like, what is the economical, social place you're living in.
And also if you can afford.
Exactly, because I can tell you buy chicken and fish, and you can't even afford omena.
Right.
So it's very hard. So we need to work with what is happening.
Okay, there are very interesting questions here. Some of them, some of them clearly. Then we must next have some discussions about HIV. You know, the thing is, normally people, just as with nutrition, people assume that there's a lot of information out there, but just judging from the questions that I'm seeing here on 22422, things about can kissing transmit HIV, you know, things that, you know, people assume people know. Then it's definite that we might need to cover this topic again. All right, maybe then as we wrap up as well, when you've talked about early on just the importance of food safety, and when you talk about food safety, then comes the other thing which we talk about in nutrition, which is food storage. So even as we wrap up, like the people who say store the sukuma wiki imelala kwa maji, or there are certain fruits that are not supposed to be put in the fridge if you have one. So what are some of the things you should look at when you talk about food storage?
So once check, do you have a fridge or not?
Right.
So if you have a fridge, what are the temperatures in the freezer and what are the temperatures in the fridge? So you look at what is your fridge like? Is it a one door? If it's a one door, then you know the freezer will be affected because it won't always be frozen. Something else you check if before you store the food, have you cleaned it? Because you don't want to just take the mboga and just
put it in
freeze, yeah?
Baridi itaua.
Exactly. It does, but not efficiently.
Right.
Yes, because there are organisms that don't thrive in very cold setups, but there are those that do thrive in such like. So you want to look like things like proteins, you have to boil before then store. That is easier. Because if you just buy your chicken and store, all the microorganisms inakaa tunayo. So you'd rather clean and boil than store.
Okay.
Things like your greens, you don't want to cook them before. Because again, you would like to ask, how are you cooking before storage? Because once you remove from the fridge, you'll probably cook again. Yeah, so you might want to maybe just blanch it until it's almost done, then you freeze. Like we do with our kienyeji mbogas. We blanch, then we freeze, so that when we are cooking, we just remove and then we stew. So it just depends what the type of fridge you have. Things like milk, there are milk that can stay longer without the fridge, those that can do with the fridge. So it just depends.
What about things that I see, it's common in most homes where you buy pre-boiled beans, pre-boiled githeri, peas, lentils, and you store that. Is that okay, safe? Good?
That is safe only if you know how it has been pre-boiled. What the type of water the person who's boiling it before is using. What is the hygiene status of that person? Because you can find maybe they are made by the roadside with the dust and all that. And once the immunity is compromised, those are the things we don't want you exposed to. Because if you make it yourself, then you have soaked it prior, you have boiled it with clean water, you have cleaned it, you have stored it in clean containers, such like things. But if you want to buy them prior, just get to know the hygiene of the person you're buying from, the type of water they're using, whatever setup they have in terms of that pre-boiling. Yeah.
All right. Well, I would like to keep my record. I said from last week, by the way, I've been ending at 9 sharp, which people are very proud of. And very shocked that I can do. But anyway, maybe you can tell the people where you can find them, where you can be found in terms of online, where they can reach out to you. So of course, there's still so many questions here as well.
Okay, so I have a clinic which has been running for, I think, 2 years now, 3 years, yeah. The clinic is in Fortis Suits, next to Kenyatta Hospital bus terminus on Upper Hill. So Fortis Suits on 8th floor, suite 809. I'm working with a great team called Mirazi Healthcare. So once you get in there are 2 lovely ladies at the reception who will be more than willing to welcome you, do the anthropometric measures for you. Yes. Then they will call me in and definitely see you. Online, you can get me on Diet Select across all platforms, Twitter, TikTok, Facebook, Instagram, Diet Select. Then we can continue the conversations. Like we can still do the questions and answers there.
All right.
Yeah.
Well, thank you so much for coming and for taking time to answer some of the questions. If we would expose some of you and some of the questions that you ask here, it is okay. But hatukupati namba, wacha tuseme hiyo. Thank you so much. We appreciate your time and all your feedback. I'd like to say thank you. After this, coming back is the repeat of what happened earlier on, but keep it Citizen TV, Citizen Digital for all your updates that you require. Mungu awabariki sana.